Hi FreeBody family, Kat here, and this is the video that so many of you have been waiting for, how to release all of the hip flexors in one sitting. What's a quick practice that you can do to release all of your hip flexors coming up next. Hey there family, so you're gonna need your FreeBody Basic Plus toolkit. So that includes the soft ball, essential for the psoas. Do not use a firm ball in your psoas. You're gonna need the larger, firmer ball, yours might be blue, to really get into those adductors, and you're gonna need a smaller ball, the smaller myofoam ball, to get into tensor fascia lata. So quick review, psoas, hip flexors are psoas, iliacus, pectineus, adductor longus and brevis, Sartorius, rectus femoris, one of the quads, and then also TFL, and we'll hit a little glute min while we're at it. So those are the basic, the group of the hip flexors. So when you have hip flexor tension, stop blaming one muscle, hit them all for the best experience of release. Now, the other piece is, and I did a whole big talk on this, giving your hip extensors a little bit of release first is a great way, because often, as I say many times, often the muscles that we feel are tight are actually the ones that are pulled taut. And sometimes you might find that giving a little bit of release to your hamstrings, like I'm doing now, I got that bigger, firmer ball under my hamstrings, I'm lifting up, I'm just rolling along. Sometimes the hamstrings and that glute max are so tight that they're pulling the pelvis in a tuck, and that overstretches the hip flexors and makes them freak out. They feel tight. No amount of lunges that you do is ever going to release them because they're already stretched. They're already long. So give the hip extensors just a little bit of rolling there, bottom of the buttocks, just above the sitting bone, rocking side to side. That's going to hit all the primary trigger points in your glute max. So I got that ball right above the sitting bone. Like as I go across right there, I can feel the sitting bone at the bottom of the ball where I'm rolling. Oh, glute max, so good to release. Okay, so now I've released my glute max and my hamstrings just a little bit. So I'm going to release my right side hip flexors. You can go back and do it on the left when we're done. We're going to start with iliacus. So to get into iliacus, you've got to find the top rim of your pelvis. If you have a lot of flesh here, it will be difficult to find and feel that. And there's nothing I can specifically say to you except maybe laying on your side so that your belly flesh drops away. That might make it easier for you to find the top rim of your pelvis. Iliacus lines that top rim, so we got to get our thumbs kind of in line often with the belly button, but on the pelvis, and then I sink my thumbs down in and then push up into, so my thumb is hooking into the pelvis. I have tried iliacus release tools. I don't love them because they're all so hard. So I like to slouch down a little bit, find the top rim of the pelvis, get the thumbs in there, sink in, give yourself a slouch to soften that tissue, push the thumbs out wide. Ah, so good, so good. So I did do, of course, a whole long video on releasing iliacus, but you're gonna look for a tender spot. There's mine. Whoa. Take a couple breaths. Remember, iliacus tends to refer to the front of the thigh, making you think you're having quad issues, but it might actually be coming from iliacus. So my thumb is pushing into the side of my pelvis. Ah, that feels better. You could play with a little tilt and tuck. Ah, great. So now I've released my iliacus. I'm going to go into psoas. Its main trigger point is deep in the belly, up against the spine, right next to where the belly button is. So come down onto your elbows, Put that ball in right next to the belly button. You can stick your finger in your belly button to make sure you're in the right spot. Other knee goes out to the side. So my left knee is bending out to the side. And then I'm sinking in right there, doing a little rock side to side. I notice as I get closer to the belly button area, whoo, it gets tender. And then I back off. And I'm just going to sink right into that tender spot. Soft ball only. Please only use a soft ball in your psoas. There are delicate nerves and blood vessels laying right on top of the psoas. It does not like it when you push with a firm object like a hard ball. If you don't feel it release, it's okay. You're training the muscle to release. It may not release the first time you do something on there. You may not release the first time you press there. That feels better. So you just take like 3, 4, 5 breaths and then move on. So the rest of these hip flexors are now, it's everything that draws the thigh up toward the belly or the chest, right? So all of these muscles around the front of the thigh all contribute to hip flexors, the ones that also attach on the pelvis. So we're going to start in here on the adductor longus and brevis, move into pectineus, move into sartorius, move into rectus femoris, and then come out into TFL. We're also going to hit another psoas iliacus point along the way. So you'll need a block. You're going to take, you can always start with the soft ball because you just don't know how tender things are, right? So find that thick tendon. It's usually right along the inseam of your pants. Adductor longus and brevis trigger points are right in that upper section, right just below the pelvis. So I'm going to take my soft ball, put it right on that thick tendon. And rock a little bit, sink. Oh, it feels so good. Now you can tuck the other toes under, lift that left knee off the floor. That's going to drive more pressure into the ball. And if you really want more pressure, this is what the ball, I like to use the larger of the myofoam balls. It's a larger, firmer ball, about the size of a softball. So good. Such great compression there. Adductor longus and brevis, we're kind of getting around the same time in the same place. Just find an area that's real tender there. Take a couple of breaths. Relax your body. Relax your muscles. Soften and sink. I'm feeling now more circulation in that area. I can feel a little bit of pulse come through. That's totally fine. Feels so good. Now moving along, we're just going to keep moving around that pelvis. We got adductor longus and brevis. We're going to go into pectineus. So we're just going to move the ball to a little bit on the front of that thigh. And I'm going to turn this way so you can see right where that is. Pectineus is in there. Now I prefer to use the small ball in my pectineus. And here's that inseam right there. Here's the thickness of sartorius and the quads. I'm getting right in that little valley right there. Whew. And that is exciting. Let your body sink into their tender, tender place. You can tuck and tilt your pelvis. As you tuck, it's going to drive the tissue into the ball to get that pectineus. Little muscle, big attitude. Hip flexor and adductor draws the legs towards each other. One more breath. Okay. Now, Sartorius. Sartorius goes from the ASIS, flanks those quads. So we're going to get just a little bit higher up. I'm going to go back to this larger ball. So I'm right about where I was with the pectineus. Notice I'm going to lift that right foot up a little bit. I lift that right foot. That's going to rotate my thigh onto the ball. Okay? So we're going to get that lifted up a little bit and rock a little side to side. I'm still using the block to lift it up. Ooh. So play with the angle of the foot, how much you lift it. Find some tender spots in Sartorius there. Ah. Ah. Relaxing your muscles, relax your body. Follow that tender line up. Ooh, good spot. Great. Now, that little spot, psoas iliacus point, is right below the groin. And that's usually the place where people are like, I feel it right here, right? So we're going to get that spot. I'm going to show it to you in the camera. Here's the line of the groin. Here's adductor longus and brevis I've been working on. Pectineus is in there. Been working in Sartorius. I want to get up close to the groin, just below the fold. See where that crease is? And then I'm going to get that little ball right in there. I'm going to place that on the block. And sink down. And then you can check and see, do a little tilt and tuck of the pelvis. The tuck is going to drive the tissue into the ball. You could even do a little lift of the leg if you want a lot more pressure. Ooh, ooh, ooh. So exciting. Oh, great. Shoo. Okay. I'm going to take a little break and open wide, do a little flip-flop. Feel the difference, because the muscles we've been releasing so far are not only hip flexors, technical difficulty there, but also adductors. Pectineus, adductor longus, brevis are also adductors. Great. We've also covered a little bit of Sartorius. Basically, you just want to go across the total top of the thigh, close to the pelvis, around the center, front, and toward the outside of the thigh. So now we just did that psoas iliacus point. We treated a little bit of Sartorius. Now we're going to go around. Rectus femoris is a quad. So it goes along the very top front of the thigh, and often you have to angle a little bit to the side to find its trigger point. So you might start with the softer ball, put it right below the crease, but now you're more at the very front of the thigh, and just go up and down there a little bit. Smooth it out. And then start dropping your hip, that right hip, out to the side a little bit. Cover a little bit toward the side of the thigh. And then when you find a little tender spot, you might bend the knee. This point tends to be just above the level of the pubic bone, so you could put your fingertips on your pubic bone, see that you're about in line with the pubic bone. I want a firmer ball there, so I'm going to go with the larger myofoam. Put it there, right at the top of the thigh, and then a little bit out to the side. So you could bend your knee and drop the foot very slightly out to the side. Oh, there it is. Yes. Rectus femoris, quadricep muscle, also a hip flexor. Pulls that pelvis down toward the thigh when you're standing, makes it hard to stand up. Also can cause knee pain and knee buckling. You'll want to watch that anatomy video I did the other day. It's going to help you understand other symptoms that you might have besides hip flexor tension. Ooh, so good. Great. Now, finally, we're going to go into TFL. TFL, find the top of the pelvis. It's toward the crease. It goes into the iliotibial band, toward the crease of the thigh. It goes from the ASIS back to here. So we've got to get the ball right on the front of the pelvis and kind of come a little bit on your side. Now, my hips aren't totally stacked. My top hip goes forward a little bit so that I can get that ball right in that front area of the pelvis. Oh, and this requires a lot of sinking and relaxing to get that tissue to soften, to get that ball in there. TFL is a main cause of iliotibial band aching and making your iliotibial band feel tight and stuck. Which again, it should be. It's a stabilizing structure. It should never be loose. You don't want a loose iliotibial band. Oh my gosh. And then just for fun, I always like to I want to stack my hips and get into the very side of the pelvis in glute min. Very side of the pelvis, little glute min. And I'm going through the very top of the iliotibial band. Okay, now we're going to move off the balls. And now we can do our lunge, right? If we just started with doing the lunge, number one, if the hip extensors are really tight and pulling those hip flexors, a lunge is never going to help. Number two, when there's trigger points in the muscles, if you pull on them, they will resist stretching. So they're going to pull back, and you might find the lunges actually make you feel a little worse. But now we've released some trigger points. We've hydrated the fascia with the rolling. So now we can do our lunge. So step that leg back, drop the pelvis, and then back up a little bit. And then drop the pelvis, and then back up a little bit. Drop the pelvis, and you could even grab the foot, and then back up a little bit. You can add a little adductor stretch by bringing the leg out to the side and getting those adductors open, because the adductors are also hip flexors, most of them. And then do give yourself a little hamstring and glute max stretch. Press the foot into the floor a little bit to engage those tissues. Nice big stretch. Back to the lunge. Great. And then now you can do all of that on the other side. Simple way to think about it. Belly next to the belly button, deep by the spine, soft ball only. Iliacus hook in. You're trying to push into the liner of the pelvis. Then start at that thick tendon that's kind of along the inseam of your pants. You can feel that thick tendon right there. Adductors. And then just make your way around the top of the thigh. Adductors, pectineus, Sartorius, psoas iliacus point right just below the groin line, Rectus femoris, and then that outer pelvis point, tensor fascia lata. Now your hip flexors should feel much freer. Cat Matlock here at FreeBody, and I'll see you in the next video.